Hi, my name is Jessica Bihuniak. I recently received my PhD from the Nutritional Sciences Department at the University of Connecticut in 2013. I currently have a faculty position as a lecturer and advisor in the Department of Allied Health Sciences at the University of Connecticut. I have a secondary appointment as a visiting scientist of medicine at Yale University School of Medicine. And I'm currently interested in how dietary protein and specifically different functional groups of amino acids affect the calcium economy. So dietary protein and bone health has been a very controversial area, and there's been some recent evidence to suggest that increasing dietary protein, at least in the short term, from right below the RDA at 0.7 grams per kilogram per day to 2.1 grams per kilogram per day, increases intestinal calcium absorption. But that's only been demonstrated over the short term, about 5 to 6 days. And so we wanted to see if supplementing older men and women who consume low moderate protein diets with a whey protein isolate was beneficial to bone density, assessed by DEXA. And so we undertook a randomized double-blind placebo-controlled trial in about 208 postmenopausal women and men over the age of 70, and we assessed bone density as well as a number of secondary outcome measures. So we looked at body mass, we looked at measures of strength, we also assessed dietary records, and basically what we found was that there was no positive or negative effect of a dietary protein supplement for 18 months on bone mineral density when you take individuals who have a low moderate protein diet and you provide them with about a 40-gram whey protein supplement. So they started out with a baseline protein intake of about 1.06 to 1.07 grams per kilogram per day. And with the addition of the protein supplement, their protein intake increased to about 1.4 to 1.5 grams per kilogram per day. And this had no significant impact on bone density when assessed by DEXA or by quantitative computed tomography, which allowed us to look at both trabecular and cortical bone. However, we did see a significant effect on truncal lean body mass. So individuals that consumed the whey protein supplement had a higher truncal lean body mass at the end of the study compared to those on the control, which was a maltodextrin supplement. Body weight did not change throughout the study, and neither did BMI. And so we think this has some significant clinical implications that protein supplementation above the RDA may be beneficial in the elderly to preserve lean body mass without altering kidney function. We saw no harm to the kidneys and no harm to bone density.